Have you been feeling depressed or tired? Been putting on weight for no reason? Or suffering from hair loss or dry skin? You may not know it, but you could be suffering from hypothyroidism. Hypothyroidism is a type of thyroid disease, which arises when your thyroid doesn't make enough thyroid hormones, and this is very common. It affects up to 5% of the general population, with a further 5% estimated to be undiagnosed, and it disproportionately affects women. Your thyroid is a small, butterfly-shaped gland found at the base of your neck, which many people don't even know exists. However, it has a massive impact on our bodies. It makes the hormones T3 and T4, which go all around our bodies and tell our cells to increase their metabolic rate, which is the rate at which we convert the food we eat into energy and other things necessary for our survival. I somewhat recently made a video called Understanding Your Thyroid, which goes into much more detail about what's actually going on, so feel free to check that out if you're interested. Having hypothyroidism basically causes everything in your body to work more slowly and less efficiently, which can cause an extremely extensive list of symptoms, so buckle up. Fatigue, weight gain for no apparent reason, high cholesterol, which is a fatty substance in your blood, high sensitivity to cold, slow thoughts, slow movements, slow Achilles reflex or ankle jerk reflex, slow speech, panic attacks, memory loss and confusion, mental sluggishness and brain fog, poor concentration, noises and voices in the head, phobias, loss of drive, loss of sex drive or libido, postnatal depression, depression in general, nightmares, difficulty sleeping, upset easily, mood swings, personality changes, feelings of resentment, wanting to be alone, a lack of confidence, nervousness, anxiety, ADHD, vertigo, balance problems, a lack of coordination, dizziness, migraines, headaches, noises or hissing in the ears, deafness, tinnitus, poor visual focus, double vision, dry or gritty eyes, blurred vision, pins and needles, breathlessness, irregular heartbeat, high blood pressure, a slow or weak pulse, liver tenderness and enlargement. I'm not even halfway through, I kid you not. Anemia, where there aren't enough red blood cells or hemoglobin to carry oxygen around the body, which results in pallor and weariness. Urinary and upper respiratory tract infections. Albuminuria, where there's protein in your urine. Pelvic inflammatory disease, or PID. Candida, which is a type of yeast or fungus that causes thrush. Heavy eyelids, muscle cramps and weakness. Joint stiffness, diminished sweating. Dry or flaky skin. Rough patches of skin, boils and spots, eczema, psoriasis, bruising, hypoglycemia, which is where your blood sugar is low, puffiness of the eyes, face, hand, feet, or ankles, back and loin pain, wrist pain, foot pain, burning feet syndrome, carpal tunnel syndrome, which causes pain and numbness in your hands or fingers, numbness in the legs, toes, arms, or back, alcohol intolerance, constipation, hemorrhoids, irritable bowel syndrome, abdominal distension or flatulence, hair loss, dry and brittle hair, brittle and flaking nails, loss of the outer third of your eyebrows, eyelash loss, hoarse voice, goiter, which is an enlargement of the thyroid gland, difficulty swallowing, a sore throat, a swollen tongue, a scalloped tongue, choking fits, a dry mouth, halitosis or bad breath, a lump in your throat, postnasal drip or PND, which is when you have more mucus than normal and it drips down the back of your throat, which can feel like a tickle in the throat, cessation of periods or amenorrhea, scanty periods or oligomenorrhea, heavy periods or menorrhagia, infertility, and premenstrual syndrome or PMS. In children and teenagers, along with these symptoms, there can also be other signs such as poor growth that leads to short stature, delayed development of permanent teeth, delayed puberty, and poor mental development. In short, having hypothyroidism is a good time. If you're sitting there checking a lot of these symptoms off, or even just a couple, it's a really good idea to see your doctor, as if hypothyroidism goes untreated, it can turn into something a lot more serious, such as heart problems, as it can lead to a higher risk of heart disease and heart failure due to high levels of the bad cholesterol. Peripheral neuropathy, as long-standing hypothyroidism can cause damage to the peripheral nerves, which carry information from the brain to the spinal cord and the rest of the body, and this can cause pain, numbness, and a tingling in the arms and legs. A myxedema coma, where the thyroid hormone levels are so low it can cause confusion, hypothermia, and drowsiness. A myriad of pregnancy complications, such as preeclampsia, which can cause high blood pressure and fluid retention in the mother and causing growth problems in the baby. Anemia in the mother, an underactive thyroid in the baby. Birth defects and problems with the baby's physical and mental development. Bleeding after birth, premature birth or a low birth weight, and a stillbirth or miscarriage. For a condition that not many people know about, hypothyroidism can be extremely dangerous if left untreated for an extended period of time, and so it's important to get it diagnosed as soon as possible. Thanks for watching what is basically a long list of doom and gloom with silly drawings, and stay tuned for part 2 where I'll explain the types and causes of hypothyroidism.